Dr. Pete, I have a
Yes.
question.
Yes.
With your, 20 years of experience in, treating patients, especially, in the community, what are something that you feel like contributes to the higher rates of African Americans being impacted, and what are some things that, culturally you think that are faced with, and any advice that you have with treatment?
That's actually a good question, and I think what we have to come to terms with is that our patients are people and that they do not operate in a petri dish, and that they come from communities, they live in society, and so those societal factors impact their access to care, how they relate to the healthcare system. They impact the relationship between their providers.
Yeah.
And so there's a well-known public health model called the social determinants of health. And so that model essentially says that someone's health outcome is tied to their economic factors, their housing, racism, and sexism.
Yeah.
And I think what happens is, particularly in the African American community, that there are so many competing factors. Mm-hmm. Rather, it's the person that is HIV positive, but yet they're having housing challenges. They don't have the support that they need. They're experiencing stigma, where people judge. This is not like having heart failure or diabetes, where people say, "Oh, this person has a heart disease." Well, when you say you have HIV, there's a stigma that's placed on you. So even accessing care becomes an issue because, okay, what do I say when I go to the clinic? If I think I was exposed to HIV? So there's so many factors, there's so many social, economic, cultural factors that play a role in our lack of access to care, lack of cultural competency, where our providers feel connected to us and we feel connected to them.
Absolutely.
So that's important too. And it's not just that our provider should be connected to us, but how well does the patient connect to the provider, and to that matter, the healthcare industry. So my long-winded way of saying that there's so many social factors that impact the African American community, and it impacts how we access care within the healthcare industry, and even the speed in which we do that, right? So if there's some communities are very well versed, and when something happens, they immediately are able to go and hey, I don't feel right, I have a headache, I have a sore throat, I have fever. Those are some of the signs that you might be HIV positive. So some people, I have patients who they didn't have time to deal with that. They were struggling, trying to work, trying to make ends meet, and trying to put food on the table for their family. Yeah, they had a fever. Yeah, they had a sore throat. Yeah, they didn't feel well. But they literally could not focus on that. They had to focus on other things that at the time appeared to be more important. What suggestions do I have? Well, one is most of the centers of excellence around HIV treatment and prevention are places that have a multidisciplinary team put together. And that's the hard part, because doctors like to be with doctors.
Right.
Because even when you and I met, it was just like a natural thing. We was just right there. But when we take care of HIV, you really do need social worker. You need psychology, behavioral health. You're right. We need substance use team involved. We need ministry, and you don't have to adhere to a certain religion necessarily, but just someone that can speak to your spiritual needs. And with those, and we call them, and then also a team of really good nurses, and we call them care coordination, right? Now that's the nurse that's gonna make sure that, Jimmy got a prescription. Did Jimmy go to the pharmacy? Did he pick up the medicine? Right. That care coordination team is important to do that. And then the social worker making sure that housing is stable, making sure that they have food. And so the real good places have those teams in place. And even the federal government funds people that get Ryan White funding. You're not going to get Ryan White funding just to have a doctor or a nurse practitioner or physician assistant writing prescriptions for the antiretrovirals. That's not going to work. We know that. We talked about this. Between the 86% of the people that are diagnosed, there's only 44% that are engaged in care. Where's the other 26% or 46%, whatever? So the point is that requires a team of people to engage those folks in care.
Yeah.
To say, look, we understand the stigma. We can't dismiss it. Like, it's easy for someone to say, oh, don't worry about the stigma. Well, you're not HIV positive. You're not considered damaged goods. I say that because that's many times what our patients feel like.
Feel that way.
And so we have to validate that, but to say, you deserve to live, you deserve to be cared for, and to be treated with respect. And so outside of that multidisciplinary team, I think the respect issue is huge.
It's huge.